السلام عليكم. السيمينار مالتنا بعنوان Embolism، مقدم قبل الطلاب علي صالح، طه عبد السلام، وحيدر خليل. طبعا شكرا للدكتور كرم وفرع الأمراض لإشرافهم على السيمينار. Embolism is the attached intravascular solid, liquid or gaseous mass that is carried by the blood to a site distant from its point of origin. So, we can say that embolism is the process of partial or complete obstruction of some part of the cardiovascular system by any mass carried in the circulation. There are many types of emboli. First, thromboembolism. 99% the embolus is a piece of a thrombus. It is the most common type. Second, fat embolism. If the obstruction in the circulation is by fragments of adipose tissue, it is called fat tissue embolism. Third, gas embolism. Air, nitrogen, and other gases can produce bubbles within the circulation and obstruct the blood vessels. 4. Amniotic fluid embolism during labor and in the immediate postpartum period. 5. Atherosclerotic embolism. 5. Atherosclerotic embolism. Atheromatoous plaque, especially from aorta, may get eroded to form atherosclerotic emboli. 6. Tumor embolism. Fragments of tumor, malignant tumor cells invade the local blood vessels and may form tumor emboli. Bone marrow embolism can occur after massive trauma and in patients with bone infarction secondary to sickle cell anemia. And finally, foreign body emboli as bullets. Now we have effect of embolism. What are the effects of embolism on our bodies? An embolism can cause partial or total blockage of blood flow in the affected vessel. Such a blockage, a vascular occlusion, may affect a part of the body distant from the origin of the embolus. هسه زميلي طه راح يكمل وياكم.
Welcome everyone, my name is Taha and I will explain another part of our seminar. Now I will talk about pulmonary thromboembolism. Pulmonary thromboembolism is the third most common causes of cardiovascular death after myocardial infarction and cerebrovascular accident. In more than 95% of cases, it begins as thrombus, typically forming in a large leg or pelvic vein. It dislodges and travels up the inferior vena cava through the right side of the heart and into the main pulmonary arteries as they branch. Pulmonary thromboembolism originates from a thrombi within deep leg veins proximal to the popliteal fossa, and embolization from the lower leg thrombi is uncommon. Fragmented thrombi from deep vein thrombosis are carried through progressively larger channels and usually pass through the right side of the heart before arresting in the pulmonary vasculature. Depending on the size, pulmonary emboli can occlude the main pulmonary artery, impact across the bifurcation, this is the saddle embolus, or pass out onto the smaller branching arterioles. Rarely, an embolus may pass through an interarterial or interventricular defect to gain access to the systemic circulation. This is known as paradoxical embolism. Saddle pulmonary embolism is a form of large pulmonary thromboembolism that straddles the main pulmonary arterial trunk at its bifurcation. As can you see in this picture, at the pointer, there is a large embolus blocking the main pulmonary trunk at its bifurcation. Paradoxical embolus. The emboli go from the right side of the heart to the left side. It's usually a blood clot, but may be a fat particle, air, amniotic fluid, or tumor. Now in this picture, We see a paradoxical embolus crossing between the atria through a patent foramen ovale. This is a microscopic appearance of pulmonary thromboembolus in a large pulmonary artery. There are interdigitating area of pale pink and red that form the line of Zahn, characteristic for a thrombus. Now, the major clinical and pathologic features are the following. Most pulmonary emboli, 60 to 80%, are small and clinically silent. With time, they undergo organization and become incorporated into the vascular wall. In some cases, organization of a thromboemboli leaves behind a bridging fibrous web. At the other end of the spectrum, a large embolus that blocks a major pulmonary artery can cause sudden death. Cor pulmonale, sometimes numerous small emboli, may obstruct most of pulmonary circulation, resulting in acute right heart failure. Another mechanism is by release of vasoconstrictor substance from platelets or by reflex vasoconstriction of pulmonary vessels. And cardiovascular collapse occurs when 60% or more of the pulmonary circulation is obstructed with emboli. Embolic obstruction of medium-sized arteries may result in pulmonary hemorrhage, but usually doesn't cause pulmonary infarction because of the double blood flow into the area from the bronchial circulation. Obstruction of relatively small-sized pulmonary arterial branch may result in pulmonary infarction. Multiple emboli over time may cause pulmonary hypertension with right heart failure. Now I will talk about systemic thromboembolism. First, what's the meaning of systemic thromboembolism? It refers to emboli in the arterial circulation. Most systemic emboli, 80%, arise from intracardiac mural thrombi. Two-thirds are associated with left ventricular infarct, and another 25% with dilated left atria, for example secondary to mitral valve disease. The remainder originated from aortic aneurysm, thrombi on ulcerated atherosclerotic bulk, or fragmentation of valvular vegetation. A very small fraction of systemic emboli appear to arise in vein, but end up in the arterial circulation through intraventricular defect, paradoxical emboli. Systemic thromboembolism can travel to a wide variety of sites as compared to venous emboli. In other words, it can travel virtually anywhere. Their final resting place depends on their point of origin and the relative flow rates of blood to their downstream tissue. Common arteriolar embolization sites include the lower extremities 75%, central nervous system, brain 10%, intestines, kidneys and spleen are less common targets. The consequences of embolization in a tissue depend on: first, vulnerability to ischemia; second, caliber of the occluded vessel; third, collateral blood supply. In general, systemic thromboemboli lodge in end arteries and cause infarction. A mural thrombus is an organizing blood clot attached to the wall of blood vessels or the endocardium of the heart. It is composed of platelets, fibrin, and trapped red and white blood cells. As mural thrombi organize, they form characteristic alternating layers of fibrin and trapped cells, called lines of Zahn. A mural thrombus may occlude local blood supply, causing ischemic injury, or detach from the wall and embolize to cause injury at a distant location. Now, if we look to picture A, we see thrombus in left and right ventricular apices, overlying white fibrous scar. And the other picture, laminated thrombus in a dilated abdominal aortic aneurysm. Enormous friable mural thrombi are also superimposed on advanced atherosclerotic lesions of the more proximal aorta, left side of photograph. Now you will continue with my colleague Haydar.
Welcome, I am Haydar and I start with fat embolism. Now, what's mean by fat embolism? Fat embolism is a piece of intravascular fat that lodges in within blood vessels and cause blockage of blood flow. Now, what cause of fat embolism? Fat embolism, it may result from fracture of the long bone, it is the most common, and second, soft tissue trauma and burn. We can see the microscopical appearance of the fat embolism. Unusual type of emboli, bone marrow embolus. The embolus is composed of hematopoietic marrow and marrow fast cell, a clear space attached to the thrombus. Gas embolism. Air may enter the circulation during first obstetric procedure and second chest wall injury. In excess of 100 cc is required to have a clinical effect. The bubble produces physical obstruction to the vessels and may lead to infarction. Decompression sickness is a type of gas embolism occurring in the individual who are exposed to sudden change in atmosphere pressure. Deep sea diver. When air is breathed at high pressure, increase the amount of gas, particularly nitrogen, become dissolved in the blood and tissue. If the diver ascends depressurized too rapidly, the nitrogen expands in the tissue and bubble out of the solution in the blood to form gas emboli. Clinically, the diver suffers from muscles and joint pain, respiratory distress, infarction in various tissues.
Amniotic fluid embolism. What's mean by amniotic fluid embolism? The amniotic fluid enters the bloodstream of the mother to trigger a serious reaction. This reaction then results in cardiorespiratory, heart and lung collapse, and massive bleeding, coagulopathy. The amniotic fluid embolism is a grave but uncommon complication of the labor. The underlying cause is the infusion of amniotic fluid or fetal tissue into the maternal circulation through tear in the placental membrane or rupture in the uterine vein. Sudden severe dyspnea, cyanosis, hypotensive shock, seizure and coma, and lastly, if the patient is survived, pulmonary edema and disseminated intravascular coagulopathy develop. Reference. طبعا اعتمدنا على هاي المصادر Robin Basic Pathology الإصدار التاسع and Harsh Mohan Textbooks of Pathology الإصدار السابع.
And thank you for listening.